All right. Well, let's get started. Thank you all so much for joining us today. Thrilled to have folks on the call and just wanted to start off by saying my name is Caitlin O'Brien. I'm the Director of Learning and Community Impact at the Scattergood Foundation. Just a couple of housekeeping items before we begin. We are recording this session and we will post the recording on our website so that folks who weren't able to join today are able to see these slides and, access all of this information. So as for what we plan to discuss today, we will give you some background about this grant opportunity. My apologies for that background noise, but we will give you some background about the grant opportunity. We will share about the application process, the eligibility criteria, and the selection criteria. We will leave about 20 minutes at the end for any questions that you have, and you're always welcome to reach out via email or phone if you have any other questions. So as we get into it, I would like to turn it over to our foundation president, Joe Pyle, who will give a little bit of background about our policy work, which is what this policy meets practice opportunity arose from. So, Joe.
Hi, everybody. I hope you all are enjoying the first day of winter. I guess we experienced summer last week and now we're into winter. So hopefully it's short-lived. But I do want to thank you all for joining the call. And we are excited for this round of the Policy Meets Practice grant cycle. I'm going to be brief, but just wanted to give you a little sense of, why we started to do the policy work we did. Back in 2016, the foundation really felt it was important to, I'll say, put a stake in the ground as it related to critical issues in the behavioral health and substance use disorder space. So we convened a group of experts across a wide spectrum of behavioral health. And that led to the establishment of some topics that led to the writing of papers, which I hope you've had a chance to connect with some of those. And as a result of convening experts, there were some foundations that focus on behavioral health in the state of New York and one in Ohio that all thought that the policy work was worth them joining. So we have 4 foundations: PEGS Foundation in Ohio, the Patrick Lee Foundation, and the Peter and Elizabeth Tower Foundation that are, both of those are in Buffalo, the last 2. And as you can see up on the slide, we've now had 26 papers commissioned. And, I think, what I hope we're doing, and this ties to why this grant cycle is important, is that the papers are on issues that we think are, pressing for us as a society to face. One of the very first papers was written by Colleen Berry down at Hopkins, and it made recommendations on how to combat the opioid epidemic. And this was back in 2016. And one of the recommendations was using a harm reduction strategy like safe injection sites, which the foundation has been supporting over the last couple of years. And hopefully this year we'll bring a safe consumption site to Philadelphia. Other areas have been around crisis services, around adolescence and mental health, and the intersection between mental health and the criminal justice system. And this paper, which Caitlin will talk, this piece here now is real related to more to workforce. And the reason that we started this series is that we recognize the people that we're working with on these papers are more in academic positions. And we know that all of you are on the front lines doing the work. You're actually practicing some of the policies that they're recommending, or some of the direction that they're asking, the communities to move to. And often you've been ahead of the policy. And I think this is an opportunity to really recognize programs in the community, the work you do, and kind of align how policy and practice meet up. So we're excited for it. I want to turn it back over to Caitlin. I'm going to stay on throughout the hour. So hopefully if there are any questions at the end that I can answer. But I think it is important for foundations to be advocates. I think the policy papers do that. And I think the best advocates are you as practitioners. And that's what excites me about this project. So Caitlin, it's back to you.
Thanks so much, Joe, and thank you so much for that background. So as Joe mentioned, the Policy Meets Practice grant program really grew out of the Think Bigger, Do Good policy series, which has focused on various behavioral health policy areas. So for this program, and this will be the second cycle of the Policy Meets Practice program, our goals are to invest in programs that connect the importance of behavioral health policy issues to on-the-ground practice, build capacity of small and mid-sized organizations, and inform behavioral health policy discussions using lessons from real-world applications. In our first cycle, we focused on the paper COVID-19 Systemic Racism and Mental Health Inequities, Policy Implications for an Emerging Syndemic, and that was by Ruth Shim and Stephen Starks. And we were able to give out a total of 8 $20,000 grants and supported some amazing work throughout Philadelphia. And as we continue this Policy Meets Practice program, our goal is really to focus on a new policy area for each new grant cycle. So for this grant cycle, our policy paper of focus is Enhancing the Capacity of the Mental Health and Addiction Workforce, a Framework, by Benjamin Miller and Anita Burgos. And this paper really recognizes the need for mental health and addiction care, that the need for this care is far outpaces our current mental health and addiction workforce. And this has been especially true in the wake of the COVID-19 pandemic, as people all over the country have experienced significantly increased levels of stress and are seeking care at higher levels. So really, behavioral health care providers are in demand now more than ever. So in the paper, they have put forth a framework looking at all of the different levels of behavioral health care. And historically, workforce efforts have focused on increasing the number of clinical mental health and addiction providers, with support for building capacity of inpatient and outpatient services, both in hospitals and treatment centers, along with community mental health providers. But these services are much more time intensive, and they tend to benefit fewer individuals with more significant need and are significantly more expensive. So, with such a great need for mental health care, we know that there are many other ways to fill the gaps. And we know that peer support specialists and community health workers can play a significant role in providing behavioral health care for the community. And they also create opportunities for individuals who have lived experience of mental health or substance use challenges, and also individuals who can bridge cultural divides and improve cultural and linguistic competency in behavioral health. This workforce can really be deployed more broadly and will cost less than a traditional clinical intervention. So for this round, we are really hoping to focus on this area and hoping to advance or to enhance the mental health and addiction workforce by supporting organizations to build out a part of the workforce that has long been under-resourced and underutilized, and that is community health workers and peer support specialists. So in this cycle, we will be giving a total of 4 grants up to $50,000 each. And grantees will have the opportunity to participate in a cohort model, building a community of practice of organizations that are doing similar work, where our hope is that we can create a community that can share best practices, share challenges, hopefully share some resources, and really be able to gain from each other's knowledge. So what does the application process look like? It really starts with the Scattergood Foundation selecting a specific policy issue and related policy papers of focus for the grant opportunity. And to do this, we really kind of look at the current landscape and what we see in conversations with our grantees and with partners, what is really needed in the community. And we know that this workforce issue is of critical importance right now, as so many people are seeking care in the wake of COVID-19. We then have this open call for proposals, and organizations will submit applications. The Scattergood Foundation staff will review applications and narrow them, and then we will send applications to a grant making committee to review applications and select grantees. Then awards will be given out, and grantees will implement their programs and participate in a community of practice. So we do have some eligibility criteria, which I think can guide you all to better understand if you should apply or not. First, we will be accepting applications from organizations with 501c3 status or fiscal sponsorship. They must be located within the city of Philadelphia and have an annual budget of $5 million or less. And our goal here is really to support small and mid-sized organizations, recognizing that oftentimes these smaller and mid-sized organizations don't receive as many grant dollars as some of the larger institutions. So really building up the capacity of these organizations that tend to have really deep ties to their community and building their mental health capacity here. So we'll also be seeking to expand the pool of Scattergood Foundation grantees, really, and will not actually be accepting applications from our current grantees. So this will include the grantees of the current policy meets practice cycle, as well as current grantees of the Community Fund for Immigrant Wellness. So if you're a past grantee and are not currently receiving grant dollars, but haven't received grant dollars in the past 2 years, you are eligible to apply. And if you have any questions, I think there will probably be a lot of questions about this specific eligibility criteria, and please feel free to reach out to me and we can discuss to provide clarity around that. So additionally, we will be asking in the grant application and sort of evaluating on the back end the leadership of your organization and whether or not it is representative of the community that you're serving. And also we'll be reviewing applications for their alignment with a policy paper of focus. So in the application, you'll really have 3 main components. You'll, answer some questions about your organization. This will include some of the eligibility criteria like 501c3 status or fiscal sponsorship, some basic contact information, a description of your organization's leadership, and some, like I said, contact information. Then we will get into information about the program itself. So you can request grant dollars for up to $50,000. And then we'd also, like that general or a description of the population that you intend to work with, and a program description. So in that, we are also asking organizations to address, and this is all listed in the application, whether or not the funding will be used to support in a new or existing program, how the community behavioral health workers, so the peer specialist or community health workers, will address behavioral health needs, how the community behavioral health workers will be identified by the organization, so what's the hiring process, how they'll be trained, how they will be integrated into the broader programming of the organization, including things like where and how they will practice, how they'll be supervised. And then we'll also be asking for a draft job description. So whether or not it's a new or existing individual, we will want to sort of know how you are or have in the past put that out into the community and, had that job description looked like, and what the outline is for their role and responsibility, including what their time commitment is, whether or not they are full or part-time. And then we will also, of course, look for a budget and a budget narrative. And we'd like to also understand from your perspective what 3 outcomes you would like to see from your organization. We also have a couple of additional questions that will be optional. So we are wanting to understand from organizations how they are thinking about 988, which is the new mental health crisis line that will be operational in July of this year. So that is if your organization has thought of it. We know that many folks have not yet even really heard about 988. So we, certainly this isn't something that we will be judging your application on, but just wanting to understand how, if you have thought about this, thought about 988, how you're thinking about it and how you plan to integrate 988 into your work. And then any supplemental information, anything else you all would like to add to your application. So some key dates, our application will be open for the next 4 weeks and will close on May 16th at 5 p.m. So if you're interested in applying, I would really suggest trying to log in or create an account on our Foundant grant portal and just make sure that you're able to access the application. And, at this point, we're really more than happy to troubleshoot any issues you're having or anything like that. And it's, easiest to do that if you create an account or log in well ahead of the deadline. Once the application period is closed, we will do our internal review and have our grant making committee review applications sort of across May and June, and then our grantees will be announced and awards will be distributed in June of this year for a grant start date of July 2022, and these will be 1-year grants. So, it is also, I'm sure, important for you to understand how your applications will be evaluated. So, first and foremost, of course, we will be looking at your applications to see whether or not you meet the eligibility requirements. We would then really focus on the program description, the draft job description, and the budget and budget narrative to understand how the community behavioral health worker or workers that you plan to hire will address behavioral health needs, what the hiring process either has looked like or will look like, how these community behavioral health workers are trained, and then how well are they integrated into your organization's work. We will also be sort of looking at what the program's potential is for expanding the behavioral health workforce, and how well does the budget fit your program needs. So how to apply. I'm going to stop sharing my screen and then reshare. So first, you can start by going to the Scattergood Foundation website, and that is scattergoodfoundation.org. And you can go to the support tab, and then down to policy meets practice. So here you'll see some more information, a link to the full policy paper of focus, so you can read that paper and gain more familiarity with the framework. And then if you scroll down, you will see this apply now button. You can click that. And you'll see here there are actually 2 opportunities that we now have open: our general grant application or LOI, as well as our policy meets practice application. So make sure that you are filling out the policy meets practice application. So you'll see on the apply screen here that the policy meets practice, and you just go over to the right-hand side and click apply. Now that is, of course, if you already have an account with the foundation on Foundant. So I'm going to sign out of my account here. And if you don't, it will bring you to this main page where you can create your own account. And you can do that just by clicking create new account and completing this information here to create your account. And if you have any trouble with any of that, we are here to help for sure. With all of that, I would like to open it up for any questions that anybody has. All right, well, if there are no questions, I will let everybody, get some time back in their day. And please always feel free to reach out to me. And I will just put my email address in the chat here. And I am happy to answer any questions via email or set up a time to talk over the phone if you have any questions about eligibility, about about sort of how you're thinking about applying. But really hope that everyone here applies and that we will be working with you all in the future. So thank you so much for joining, and I'll let Joe sign us off.
All right. Well, thank you, Caitlin. And thanks for everybody on the call, and look forward to the conversation that'll evolve over the next couple of weeks. So thank you all.